I absolutely think that people with disabilities and their caregivers definitely need to be included. They need to have decision-making power um, as we work on solutions for healthcare. Oftentimes, professionals, though well-intentioned, cannot possibly have the perspective of living with the disability. And I like to say that the people who do have that perspective have lived expertise. It is expertise. They know that something won't work for them and people like them, and they can explain exactly why and exactly what is needed. And I cannot understand trying to build systems that help specific groups of people without asking them, what do you need? How do you need it? How can we do better? This is our idea. Could you provide us the feedback? Is this workable? Is this not workable? And considering all the different groups of people with disabilities, people who have physical access needs see things that people who don't have physical access needs see, even if both of them have a disability. People who are blind are going to think of things that affect them and people like them in ways that someone who uses a wheelchair may not initially think of. We also have to consider the invisible disabilities, people who struggle with anxiety, depression, mental health conditions, people who are autistic and process sensory things in different ways, people who might need to access an appointment making system that doesn't involve a telephone call, but they can't use TTY because they are not deaf or hard of hearing. They just can't make phone calls, usually because of anxiety. But if they dial that phone, they're going to forget the reason that they called. They're going to forget an important piece of information. We have to be able to provide access to everyone, given the breadth and depth of disabilities. And without talking to people who have disabilities, we're creating systems that abled people assume will work. And there really isn't any excuse, right? The disability community is large, it's present. The community speaks. The community, frankly, begs to be heard. There are plenty of people with disabilities who want to help improve our systems, who want to provide that information, who want to participate, who want to lead, who want to help make these changes. And frankly, there's no excuse for not engaging. There's no excuse for not making sure that everyone is represented and that everyone is doing their best to include all human beings. That should be kind of the foundation of where we start, right? We need to include all human beings, regardless.